Hi, my name is Dr. Samrat Ashok Shah. I am a consultant physician at Apollo Spectra Hospital, Pune. I am going to talk about thyroid disorders because it is one of the important topic wherein most of the Indian females are suffering from hypothyroidism or thyroid related disorders. There are few things which are important to understand when we talk about thyroid diseases. Whenever you do your thyroid levels, make sure that you do your TSH levels and free T3 and free T4 levels. Do not go for T3 and T4 levels because your treatment depends upon TSH and free T3 and free T4 levels and not on T3 T4 levels. That is the first thing you need to understand. Do not do T3 and T4 levels. Please go for free T3 and free T4 levels. And when you're treating thyroid disorders, there is a lot of confusion about when to start actually these thyroid medications. Some people suggest that my TSH is 8, so I started the medicines. Some people say that my TSH was 10, so I started my medicines. It is important to understand that it does not depend just on TSH levels. Along with TSH, it is important to see how is your free T3 and free T4 levels. It is also important to see how much symptoms do you have because of hypothyroidism, and it is important to see what are your status of anti-TPO antibody levels. So if all these things are taken into consideration, only then we take a call and decide whether you need to start thyroid medicines or not. Very important thing to also know after starting thyroid medications is you should always take thyroid medications on an empty stomach. Do not even consume tea, coffee or any kind of food materials at least for 2 hours after taking these thyroid pills. It is very important to remember this. And always remember, thyroid medications are taken early in the morning and they are not allowed to be taken in the evening or in the night time because hormonal balances are maintained in a circadian rhythm which is to be right on taken when it is taken in the morning. Also important to remember is when you use salt, make sure that you always use iodized salt because iodine is necessary to maintain your thyroid functions. And it is also important not to use microwave ovens if you have hypothyroidism because using microwave oven can vaporize the iodine content present in your salt. So whenever you cook food, make sure that you keep your stove off and then add salt which you are adding for your food materials. Please make sure that you follow these basic instructions. Get your TSH done once in 3 months to make sure that the thyroid hormone levels are in maintain. Thank you.